Hi, I'm Dr. Robert Peltier, Chief Medical Officer at North Oaks Health System. It's March 16th, 2020. This is some of our coronavirus videos, and we're going to do some frequently asked questions. Our first question comes from one of our social media outlets that someone asked, could some of the people that have been recently diagnosed with flu been misdiagnosed and they actually had COVID? Well, the response to that is it's certainly possible to have both. The current recommendations are for people that have upper respiratory symptoms. The most likely pathogen is still the flu in our area. That may change, but right now that's still the most likely pathogen. So generally we're screening. It would be terribly unlucky for someone to have flu and COVID at the same time, but it absolutely could happen. So if someone has flu, they will have instructions that if they're not following the normal course of a flu, that they need to recheck. I would tell somebody even before COVID, if flu was, if they had influenza and they were home and their symptoms were getting worse, not to ignore those. So the same advice still exists. If someone has flu and continues to have symptoms that's not following the normal trajectory of flu, which is generally the first couple of days are usually the worst and it slowly gets better, those achy fever, chills, all the symptoms are roughly the same, but if they're not getting significantly better after 4 or 5 days, or if symptoms change, a new sputum, shortness of breath, fevers that were going away all of a sudden come back. That's always a time to get in touch with their provider. Our second question is essentially, are household members of someone who's sick required by law to quarantine themselves? So let's talk a little bit about the difference between self-isolation and quarantine. Quarantine really is a legal term, is my understanding. Only the health officer of Louisiana can quarantine someone. And there are some law penalties that go with that. What's being recommended now, and people will use the term quarantine, sometimes incorrectly, is that someone go home and self-isolate. Meaning that I'm not feeling well, I'm not sure what I have, and so in that case, I stay at home, I try to stay away from the other members of my family, and I get a lot of rest. If possible, if you're in a home that has multiple bedrooms, should always have the sick person stay in a different bedroom, use a different bathroom if possible. Sometimes people have only one bathroom, that's fine. But after the use of the person that's sick, it should be wiped down prior to the use of the second person and other members of the family. Certainly by law, they're not required to stay in that household, but anybody who has a positive COVID patient living in their home is at higher risk. They should still do the self-isolation practices. They should monitor themselves at least twice daily by taking their temperature. And if they exhibit any signs, fever, chills, etc., contact their provider for further instructions. We've had a number of questions about what the process for testing is. Well, as I said in my other video, which I would encourage you to watch, which gives our general update, testing is a little bit limited right now. We have only so many test kits, which we are reserving many of them for our sickest inpatients and for those patients that have significant worsening symptoms to make sure we're able to accurately diagnose those patients and give them the proper treatment. We do have a process that physicians throughout the community can order COVID testing when it's appropriate. What is appropriate? With limited testing, appropriate for now, and may change, is going to be for those patients that have significant symptoms, not just mild symptoms. So fever, chills, just feeling achy, those things are not significant. When somebody starts to have severe respiratory compromise, meaning severe shortness of breath, I would liken that to feeling like they're running a track meet and those kind of things. When you see that, you should absolutely get in touch with your provider. If they choose at that time to order COVID testing, there is currently a way that we are providing COVID tested for the community. We have got in touch with all the providers that are out there by sending out emails. They understand how to do that. Again, if you have any questions about COVID and whether you need testing or screening, please call our hotline at 985-230-2778. Again, that's 985-230-2778, or go to www.northoaks.org/coronavirus to see all of our information. Our last question is a frequent question, and that is, how long can the virus last on surfaces? It's important that we know right now we're not sure. Most studies of previous coronaviruses say on some surfaces like glass, the study that I read, said it could actually stay up to 96 hours. Most other materials, it's much less than that. Your kids are at home right now. We're touching a lot of different surfaces. I think it's important that a couple of times a day we try to go through our home and touch those frequently touched surfaces with appropriate cleaners. And there's a lot of things out there. Most household cleaners will do a fine job. Your light switches, your doorknobs, your faucets, your refrigerator handle, all of those kind of things are important that we kind of make sure we touch those surfaces up with cleaner. Your electronics, everybody has their cell phones, probably a whole lot more right now at home, playing with them, their iPads and those kind of things. You know, if we're passing them back and forth between people all day, they are a source of infection. Remember, that's got glass on the front of it, so it is a surface that it may last a little bit longer. We don't know the true number with coronavirus. This particular coronavirus, we may not know for some time exactly how long, but we can base our estimates on previous coronaviruses. So, you know, putting a household cleaner, rubbing it through your surfaces a couple of times a day, cleaning generally and keeping things tidy. And again, just as important, I can't contaminate my refrigerator if I've just washed my hands. So if you wash your hands frequently, it's less likely to contaminate a surface. Remember, try to get in the habit also of not touching your face. That's where you're going to tend to harbor a virus or transmit it if you pick it up. So think about your actions as you go through your day, and you should remain safe.